Hello, my name is Dr. David Naisbitt. Thank you for your interest in advanced surgical techniques that eliminate the need for sinus lifts, narrow diameter implants, autografts, and ridge expansion, or combinations of these procedures in patients with advanced alveolar atrophy. The surgeries you're going to see are the culmination of 22 years in the solo practice of oral implant surgery and oral implant prosthetics. The custom embedded implants in these videos are designed to support 4 to 14 teeth. My philosophy is simple. Implants must stop resorption and protect the mucoperiosteum while providing rigid fixation for the prosthetics. Anything less falls short of the high standards we must demand for our patients. The NCEI is an excellent resource for these patients that have total loss of the alveolus. The surgical techniques I have developed produce excellent outcomes like this with excess strength and the longevity of root form implants. In the fully resorbed mandible, I often found undercuts in the symphysis. The NCEI provides full arch fixation for the prosthetic and gives the prosthetic optimal anterior position over the symphysis. A partial denture destroyed number 5, making a root form implant too risky. The beauty of this solution is that the patient replaced all 4 teeth and I didn't need to do a sinus lift. The NCEI eliminated the need for sinus lifts in my practice. I would like you to know why I became an oral implant surgeon. Everyone in my extended family wore dentures. I saw what dentures did to their faces and their struggle with solid food. I knew that new dental implant technologies that could restore bone and teeth would be revolutionary, and I wanted to be part of it. Over the next 7 years, I attended the University of Puget Sound and the Oregon Health and Sciences University, earning a DMD. I began practice at the age of 39. Before dentistry, I was a United States Air Force pilot rated in subsonic and supersonic twin jets at Air Training Command and multi-engine heavy jets at Military Airlift Command. I spent 5 years flying worldwide missions and combat sorties in Vietnam. In order to attract multiple unit and full arch cases, I created the Direct Access Dental Implant Marketing Program in 1984. I wrote, designed, directed, and produced ads for television, newspapers, and in-flight magazines. I created emotionally charged headlines, copy, and phrases that kept the phones ringing for more than 3 decades. The exceptional success of direct access dental implant marketing made it possible for me to place over 19,000 oral implants and 8,000 dental implant prosthetics for more than 5,000 patients from 14 countries and 37 states. I made direct access dental implant marketing available to implant surgeons nationally in 1999. Implant surgeons that used my ads in their marketing and learned the surgical skills and techniques in my videos have added millions of dollars to their bottom line over the years. Many increased implant production over $500,000 their first year. The skills and techniques they learned enabled them to avoid compromised treatment with small diameter implants. This patient was unable to find a restorative dentist that would accept her. This is what I found, and this is what I did to revise it. If only this surgeon had learned the skills and techniques for the NCEI, so much pain and embarrassment and dysfunction would have never happened to her. My NCEI consultations converted 48% of the patients that sought my services, so I'm including a full consultation video you may find useful for your first case. In this brief clip, note the patient's aversion to sinus augmentation.
I'd like to do an oral exam and then talk to you about the implant and let you know exactly how this thing
With the thin
works.
sinuses, what are you looking at? Do you have to put some...
No grafting.
No grafting.
You don't have to do any grafting. I'm sure you're happy about that.
Yeah.
And I just really am glad that you came in to see me because I'd love to help you, Pamela, especially somebody from the medical community.
I'll probably have my sister come up and see you too.
I show you how to get a perfect bone impression in a continuous video from tray preparation to proper insertion and everything in between. Fairly small mouth. So what we're going to do is kind of custom make this tray for her. What you don't want to do is have too much of this stuff to work with. Into orbital area and back here into the pterygoid space. And here we are. Cool it down, please. Now that's a custom tray. So what we really wanted was the zygomatic process on both sides here and the interorbital area right there.
So this is just an excellent impression. We'll be picking this up in a few minutes with the modeling, the pouring of the model, and trimming, that sort of thing.
I show you how to make a temporary denture that immediately goes into full function while protecting the incision and the mucoperiosteum. Patients are amazed at how comfortable and functional they are.
This is a custom endosseous implant in a severely atrophic maxilla. This is the post-op. How many days is this now?
10.
There's about 3 millimeters of bone below the nasal antrum. We always like to tap on these to see what they sound like. We've got bone to bone. There's a sinus back there, gives it a little different quality of sound. Now, again, on this, what I've done is added some acrylic to the posterior teeth from the premolar back, and you'll see in a moment why I did that. Now, bite all the way together, please, Lourdes. But you want to notice that there is no contact on these anterior teeth. The discrepancy from the incisal edge here to where the bone is back up in here is very significant. It might be 8 to 10 millimeters. That would put a tremendous torquing force on this implant if we had contact out in here and not back here. So this spacer is essential for the initial healing because it puts all the forces going up into the body of the implant and into the zygomatic process area and into the palate. When we delivered it, this formed a natural kind of a round here. So the tissue, as it swells, is not impinged anywhere. And here we don't have any impingement or anything. The roof of the mouth is open. Okay, Lourdes, bite down hard. This is going beautifully.
The NCEI consistently produced results like this. What kind of cases can you expect from the proven custom implant ads that I provide for you? These are typical cases. The majority of these patients are seniors. They were told they could not have dental implants for obvious reasons until they saw my ad. After listening to my consultations, most patients made an appointment on the spot. When you combine effective ads and new advanced custom implant technology with a person's strong desire to get rid of painful, loose dentures and start chewing food again, cost was rarely a point of discussion. The average cost for my surgery and prosthetics was $28,000. I've been reborn again, and you don't charge enough money were comments that made me feel great, but it made me wonder if they were actually serious about the cost.
Just tell me what you think about your teeth.
Hey, I'm very, very satisfied. And if I had my checkbook, I'd write the man another check for the same amount of money.
Wow,
Now, how do you like that?
that's pretty good.
Art believed that he was doomed to life as a dental cripple, so you can see why he is so pleased. In the first video, you will learn how to control the incision over narrow ridges, cleanly elevate the periosteum, eliminate undercuts and future resorption, make a custom tray, and obtain a pristine impression. The second video demonstrates the use of gingivoplasty, gingivectomy, releasing incisions, implant insertion techniques, grafting materials, and key grafting sites, closure of oral antral defects, implant fixation, and how to achieve passive closure, which is the key to lifelong health and function. The third video is how to create the perfect temporary, make a master model, and my standardized implant design techniques. The fourth video is a full-length NCEI consultation showing what motivates patients to make an appointment on the spot. The fifth video provides NCEI special pre- and post-operative instructions that virtually assure predictable healing without complications. They include dietary restrictions, post-op medication, and specific outpatient instructions. I also include a treatment planning worksheet that has every code from unilateral to full arch cases. An NCEI consultation report and surgical report are included, so you will have proper documentation. I have been called a marketing guru by implant surgeons nationally because of the extraordinary success of direct access dental implant marketing. The program directly connected oral implant surgeons with a steady flow of motivated patients. It remains the best way individual surgeons can compete with corporate dental implant services like ClearChoice. The sixth DVD licenses you to use the complete direct access dental implant marketing program, including my ad copy and graphics. These ads are designed for senior publications and inexpensive local newspapers. This is what niche marketing is all about. The patients you have been seeing are NCEI patients that saw these ads and made an appointment. You more than likely already have 4 to 6 unit NCEI candidates in your patient files. Direct Access Marketing is a $750 program which I am including at no cost just to make sure that you get the full arch and full mouth cases like this one coming in regularly. Oral implant surgeons have adopted custom-embedded oral implant technology through private in-office surgical demonstrations. Not until now has comprehensive training for this major technological advance been widely available. Orthopedic surgeons have recently adopted custom-embedded implant technology because of rapid healing, immediate loading, and precision fit, just like the custom-embedded oral implant. Their slogan is, "One patient, one implant." I kind of wish I'd thought of that myself. My slogan is, "Be first." The use of computed tomography eliminates the need for a direct impression or first surgery. Half the time in surgery and shorter treatment time are very appealing. Obtaining working models that are perfect replicas of the jaw have been consistently successful. However, there are certain anatomical variations that rule out CT scans, which can complicate delivery and compromise stability and fit. That is why the first DVD covers first stage site preparation. I demonstrate specific techniques that address these concerns and produce the highest accuracy possible. Once you have the training program, I will consult with you at length regarding your choice of master model and many other matters that can only be addressed in direct consultation. Acquiring the skills presented in this program has a major benefit you may not have thought possible in this highly competitive world of implant dentistry. You will corner the market for a significant sub-demographic of people that are left out of quality dental implant treatment because they simply do not have enough bone mass for root form implants. There won't be anyone else in your area providing these advanced services unless you consciously decide to be the second provider in your area. You will have no competition. Just imagine, no competition. A significant percentage of my patients came to me seeking a second opinion. Custom embedded implants made up about 25% of my patients. Because of my extensive experience with custom embedded implants, oral implant surgeons have encouraged me to create a DVD training program so they can see every surgical technique close in, second by second. I still remember the frustration 31 years ago taking turns looking over Dr. Golick's shoulder, trying to mentally stitch together his protocol. All I got were handouts, encouraging words, and fading visuals. For 22 years, I started a full arch case or full mouth case and finished those cases 5 days a week. There was no time to create a comprehensive NCEI training program. What I did do was hire a videographer to document every aspect of the process. Now, after retirement, I have the time to share my ideas on patient selection and many other topics that will round out your command of this practice-building modality. Root form implants are getting smaller and smaller. When I demonstrated the many benefits of the custom embedded implant to patients who were considering the mini implant, they chose the NCEI every time without hesitation. Patients' top likes were always custom fit with nothing off the shelf, no drilling, immediate full force chewing, rapid healing in a fraction of the time, and fulfilling all three goals for high quality results. The fact that they paid several times the price for the custom embedded implant says it all. These surgical DVDs are based on my last 10 years in practice, during which time I removed only one NCEI due to a patient's failure to follow strict orders not to fly for 10 days after implant placement. He boarded a commercial flight the next day after promising he would follow orders. After watching these surgeries, you will see how easy a standardized, straightforward protocol can be. Following the clear steps in these surgeries leaves nothing to the imagination. This I can tell you. If you would like to make this important advance in oral implant surgery part of your practice, please return to the home page, scroll to the bottom of the page, and select Live Surgery Training Suite.